All right, guys, if Costa Rica's on your map, you're thinking you want to live here, there's some things you should do before you come and while you're in the process of getting your residency in Costa Rica as it pertains to health insurance. You're going to want to stay with for this one. Boy, do we have stories. We'll try to keep this down to at least under 2 hours.
We'll try.
All right, guys, I'm Michael Allen from TravelCostaRicaNow.com. TravelCostaRicaNow.com is a travel agency, so go to TravelCostaRicaNow.com. Fill out the 4-minute form, and you'll be that much closer to the vacation of a lifetime. We're like you, having best friends who live in Costa Rica, who know Costa Rica, totally hooking up your Costa Rica vacation. If you haven't subscribed, please do. I totally appreciate it. Want to see videos as we put them up, you've got to hit the notification bell. And if you just want to help us personally, please comment on the videos. It does really help. It shows engagement. Even if you put an emoji up, that's great. Or thumbs down, or again, Mike, I hate your shirts, change or something. I don't care. It's very helpful. Do you guys know Johnny? He's been in a lot of videos. Matter of fact, probably too many. Probably going to have to delete a few of them. No, just kidding. Anyway, guys, if you don't, he's our medical dental tourism. Now, we're not going to be talking about medical dental tourism, but if you need that breast augmentation, you need dental work to fix your grill like I did a couple years ago. You need hip replacement, hey, stem cell therapy, all of it. He does it all. Go to our website, scroll down, and fill out this little quick form. I will get it to Johnny as soon as possible. And you know what? He just doesn't do Costa Rica. He does Mexico as well. I've been to Mexico with him. I've been into not millions, I was going to say millions, of hospitals and talking to doctors. He's vetted them for you there too. I'm going to put a couple of videos we did in Mexico as it pertains to medical dental tourism because YouTube didn't show them to you. But they're going to be in the description if you want to see them. Anyway, so medical dental, Costa Rica, Mexico, Johnny. But we're not talking about that. Johnny, let's talk. We got the top 10 things, top 10 that you need to do before you get to Costa Rica and while you're going through the process of getting your residency as it pertains to health. Number one is?
Number one, just because, Mike, you applied residency in Costa Rica, it's not automatic that you have health care.
Wait a minute. So when I sign up and they say, okay, Michael, your process to residency, your application is in, I even get my little signed, sealed stamp said, Michael is looking for is applied for his residency, which, you know, I don't have to leave Costa Rica anymore, but I don't have insurance yet.
No. Think of it like when you're getting your driver's license and they give you that permit, a little piece of paper, it lets you drive, but you don't have a license.
Right. So you don't officially, I told this story in another video. My residency process took 4 years. I didn't care. I actually didn't mind that at all. But when they called me and said, okay, your residency is ready, it's ready, they go, come to San Jose, you're going to get your little, it's called cedula, but just think of a driver's license. It's kind of like a driver's license. And when you get that little card, they also take you upstairs to apply for your health insurance, which they call the CAJA. CAJA is a socialized medicine they use in Costa Rica. If you're going to be a resident in Costa Rica, it is mandatory that you pay in and have the CAJA, or the socialized medicine here. And because I signed up 4 years prior, I did not have health insurance until I actually signed up that day I got my card.
For sure.
Number two,
you need to plan for your health care while this time that you're waiting for this process, while you're doing your border runs, when you're going back and forth. There's a few ways you can plan.
Plan, you mean of the health insurance you're going to use? Or
how you're going to solve in case you do have an issue, in case you do have something come up.
Oh, because I don't have the CAJA yet.
You don't have CAJA yet.
Okay.
Correct. So there's 3 ways to do it. You have prepaid health, which could be via a subscription plan, a particular clinic that has it, or a system. Insurance.
Wait, let's go back to is that in the United States as well?
Yes.
Are people familiar with that? For
Yes.
people that aren't familiar with the
prepaid health.
Briefly.
Okay, brief. That. So basically it's you kind of think of it as Costco. You're going to go in there, you pay to have a discounted rate on healthcare in Costa Rica. So you'll have certain facilities around the country that will recognize this card as a discount card, that you get the rate for going to see a general doctor. Instead of being, let's say, 35,000 colones, you see them for 15,000 colones.
Well, that doesn't really sound like insurance.
It's not insurance.
It just sounds like a join my club, and my club's got members, and you go to those members and we'll give you a little discount. No? Yes?
Yes, and it also has some benefits on if you get hospitalized, and you get a discounted rate for what a regular walk-in person would get. You get a discounted rate.
I'm just going to throw a wrench in that just because that's what I do. Just because they say you're getting a discount, they just might start at a higher price, and you're paying the norm. I'm not saying they do that, but I'm not a big proponent of, you get a discount, because that's all subjective in a sense. But anyway, okay.
Well, Mike, we looked at that system, and part of our system we have a plan that's similar, but it's much more robust. It has more things that you actually use, that you should use, because the way the system's designed right now is that if you use it, this is what you get. What system that we'd like to for people to more is to use the system, but it already be taken care of. So yes, a proponent of this is good, but this other prepaid, there is ways to make good use of it.
Okay. All right. And what's the next one?
The third one is
actually real quick. So the prepaid one it sounds like that'd be like maybe for people like me that at that time didn't have a bunch of money. Would that be, is that?
Yes, it is. It is. It's at least that when you go somewhere, you got something and you know what you're going to pay. You already know what those prices are set. The price is set. You're not supposed to pay anything over this. And then you have discounts in other areas that they also fall in.
And that goes to surgery, to pharmaceuticals, to just general practice stuff?
The whole gamut of their healthcare ecosystem, which is pharmacy, laboratories, eyeglasses, dental.
Okay, I got it. I'm sorry.
It has a whole ecosystem.
Okay, I got it. Okay.
So the second one is regular insurance. Keep in mind that insurance here does take into consideration pre-existing conditions.
Now, from the state's insurance or the Costa or the Inks?
Both.
Inks here.
If you have insurance back in the States, make sure that you have to watch these, because I've seen it a lot, is that I have insurance. I have insurance state that covers me in Costa Rica. But sometimes that insurance covers you on a reimbursable method. So you spend $50,000, they reimburse you $50,000. So
because I have $50,000 in my pocket right now for that.
Yes.
Okay.
We
all do, don't we?
Yep, that's it. That's I don't even know why we're here.
So people should obviously know that.
You got to know what your carrier covers you for and what conditions to be able to use it. So you ask, is this a reimbursal, or do they contact the medical facility and they're going to pay them, and then making sure that the medical facility accepts that insurance, because it could be a 30-day period before they get paid. It's not automatic, or kind of like Mike, when people say, well, I got insurance on my credit card that covers for damages in my car. You're in the country, you're in a situation, you need to know that whatever carrier you're using covers you there. Because, we don't take that carrier. What do you do then?
All right. So again, obviously know what the heck your insurance, if you have it, does and doesn't do.
Know your policy, how it's used, how to submit it, and what conditions. There's everything that you have to know prior to coming.
Now we could actually, I don't know if we have time, but we could actually tell stories about this one, because I've been with you on a couple of these stories where they think they're good. They're not good.
We'll go briefly on one of the stories that we did.
All right, quick.
How about the Navy veteran?
Yeah.
He's got TRICARE. TRICARE is accepted here in one of the hospitals. But at the time, that hospitals, the two hospitals that did accept TRICARE, they needed letters of confirmation from TRICARE. And TRICARE at the time was not giving out letters that they would pay for the surgery.
And as I remember, he was in a bad way. I mean, I don't want to say that he was
close to death.
Yes.
And yes. So we spent the next, in short, six days working through with TRICARE to get them approved, to get to the hospital, to approve them and get them operated.
Actually, as I recall, you did that.
Yeah.
Sorry, I know you get embarrassed by that. But anyway, okay, so it's true. Know what your insurance does and doesn't do, and what it applies to and what it doesn't apply to. This is my, where you read the fine print and they say sign here, you might want to read the fine print on your insurance policy if you're coming to Costa Rica.
You got to do that. In credit card, if you're going to do credit card out of pocket, make sure you let your credit card company, before you leave the country, that you're coming here.
Why?
Well, because you can be denied. And sometimes just talking over the phone, and I've had it happen sometimes that, are you being held at gunpoint so this charge can go through? And no, I'm not holding him by gunpoint. He left the country.
He's not kidding. I know you guys are going, he's just being dramatic. No, he's not. He's not
it's fraud protection, Mike, and it's good for people that have fraud protection, but contact your credit card company. Let them know you're here.
So did that cover the insurance here? What about maybe like a traveler's insurance during that time?
Traveler's insurance, depending on what you're buying, covers you for accidents. That means you fall, you hit your head, you're covered under insurance. That doesn't mean I'm feeling bad. And in some cases, it could be that, yes, it'll cover for minor health insurance. But if you're having a heart attack, sometimes it doesn't cover those things. So no, you're
not even a heart attack is
because sometimes certain insurances say it has to have an accident related to an item before it's considered for them to use it.
So this is the broken hands and ankles and all those things that tourists get involved in.
Yes.
In any country. That's what travel insurance is basically for, right?
It's supposed to be for those accidents.
So it's not for, I don't know, medication and I got a fever.
If you need your knee replaced and you fall and they're not going to replace your knee.
Right.
Unless that we broke it in half on the way down.
It's going to stabilize you.
And to stabilize you.
So is that a good option? Would you consider travel insurance for the time?
The entire time that you're into the process of the CAJA, have traveler's insurance. Because time again, I've seen people that are during this process, well, Johnny, can I get okay, sure, we can sign you up, but I fell. You can't do it after something happened. It has to be before, and it's well worth the $200-$300 that you're going to pay.
So out of all I guess it's all variables, right? Of do you have money? Do you not? Do you whatever it is? So
the other thing, well, even if you have money, I have a gentleman that has a lot of money, but he has traveler's insurance. He has catastrophic insurance. So in catastrophic insurance is for the big things up to $3 million. And then he also has another policy that also flies him back to the U.S. if something happens. So there's things that you can prepare for, but these are things more based on good judgment, at least the first two, to keep you going back to the U.S. because it's costly.
It's funny because I know a lot of people, they watch this stuff and they go, oh, you're trying to, I don't know, sell insurance or something. But if we could sit here, if we could make that 10-hour video of all the times people have been here that didn't have insurance or didn't, all that. Famous last words, I'll be good, I'm healthy, or whatever it is. And now all of a sudden you're stuck in a country that you're not from. You're not even a resident yet. Something happens. And trust me, trust Johnny, it can go south really fast.
We had a young lady. She was 75. She's never been on a horse. She's been in the country 2 days. She fell and broke her wrist. She had traveler's insurance. $13,000 later, because
13. What?
yeah, because what happened is, and I'll put it out there. Sometimes some people will take advantage of an emergency situation, so they flew her from Guanacaste all the way to San Jose.
And a broken wrist?
For a broken wrist. They flew her. And the helicopter ride between Guanacaste and San Jose on a regular basis is about $2,500. Sometimes you can get it for less.
But obviously they took advantage.
They took advantage. So when a medical situation, the helicopter becomes an ambulance, now it's between $5,000 and $7,000 to do that same ride. So I want people, you should be prepared, but also be conscious of where you're at.
Okay, let's go to 4, I think.
Number 4, a lot of people say, oh, I'm healthy.
Yeah.
You don't know you're healthy unless you had some blood markers checked, see what you're understanding. And even when you have blood markers checked, did you have a colonoscopy? Have you had a gastro? These things, understand your body before you
yearly physicals.
Yeah.
Well, even more so, right?
Yeah, even more so, because sometimes a yearly physical is going to the doctor. I'm going to get some labs done. How do you feel? I feel great, doc. And you're gone.
Right.
Trust the paper of where you're coming from. Understand your conditions before you come, because what happens is that you're going to bring that issue from the U.S. here, and now here you have nothing, at least where you're coming from. And some people use your insurance. Number 5, chronic conditions, Mike. This is something that I deal with a lot, is that certain people want to, with chronic conditions, like they have a heart condition, or they have a cirrhosis, or different areas of their body that needs a specialist, but they want to live at the beach. And although there are specialists in that area, they're mostly between an hour and 2 hours away.
Yeah, if you live, there's 750 miles of beach in Costa Rica, basically, and none of those beaches that I can think of, maybe Limon, I don't know.
Limon has a,
but nobody goes there. Tourists don't go there normally.
No,
but so what he's saying is, most beaches are at least an hour away from a hospital that can take care of a more serious event.
You have urgent care clinics, small urgent care clinics, but if you get in a surge, and they do their best efforts to stabilize you, but unfortunately, they don't have everything you need for. They can stabilize you, get you a point, and get you on that helicopter that can cost you some money and get you back to San Jose.
I've seen it. I've had friends that use they have a problem here, and it's a big, hip broken from here, had to get on took an ambulance to Ciudad Quesada, which is an hour away, and and some things are more serious than others. Right. So
yeah. So, and if it's too serious, they may not operate it here. They might have to go to San Jose because the specialist's not here.
Right. Yeah.
So you
true.
You run the risk of things happening.
So don't be living on the beach.
And then once when you have this emergency, these things, remember this, is that an emergency is what they. It only starts and stops when you start and stop it, because if you walk into a facility, that's not an emergency to them. You're walking in, you're okay. My suggestion...
That's a good point, actually. I see what you're saying.
My suggestion is use an ambulance. If you're going to get into an emergency situation and you want to be seen quickly, come in an ambulance.
Obviously, but they're going to prioritize the ambulance.
They're going to prioritize the ambulance. You're going to get in. You're going to be seen quicker. In the private sector, you can walk in and they'll put you in an emergency, but even coming in an ambulance just gives you priority.
Right. Obviously, you're going to pay.
You're going to pay.
But if it's something more serious, then it might be worth the.
It's worth the trip.
Yeah.
I think when you do. And then this is something that has helped me and I've always tried to do, is that be nice to the entire staff. even if they're not doing anything, they're being government workers as they are, be nice, because you do not want to be put on a blacklist in that particular situation.
Are you starting a conspiracy theory in Costa Rica healthcare?
Well,
What is a blacklist, Johnny? Oh my gosh.
It's when they got you down as a perpetual problem.
Yeah, I know some people that have done that too.
Yeah. So it's, and then the other thing too is that, and I'm going to tell you this personally.
Yeah, because no one's watching. No one's watching this.
My mom, my own mom, she was from the American system from a long 40 years in the U.S. And she checked her, because you can check yourself out of a hospital here, but she checked herself out of a hospital, but her arm was still broken because she was waiting too long. My own mom. And she didn't call me, obviously.
I was going to say, what the hell?
No, she didn't call me. She just went and she checked herself out. So
wait, checked herself out because they...
No, she checked. She was in a hospital. She was there for a day in a public hospital, and she's got the CAJA. She was there for a day. She checked herself out.
Because
she wanted to go home because it took too long.
Gotta love mom.
I love her. But what happened is that when I said, Mom, you can have an embolism. You can have a lot of things that go wrong with this. Well, she checked herself back in. So what happens?
I can see where this is going.
She went to a different hospital. Guess what? The first hospital contacted this other hospital, and the note said she checked herself out. Why? Well, that added on 15 days of waiting. And you can't tell me that it was on purpose. My mom has a broken arm, should be operated on, but she took herself out of their emergency category. Now she's good enough to go back home. She's good enough to wait.
Are you trying to say Costa Ricans could be passive aggressive in certain situations?
Oh, yeah.
Why didn't she, just out of curiosity, why didn't she call you? Does she know what you do?
Yeah, she knows what I do. And I don't know.
I don't know what that says about you, Johnny. I'm not sure.
Well, she got inpatient in the hospital, and since I blame her, but I don't blame her. We're very coddled. We expect things as Americans in the U.S. that they're going to take care of you, and it's not that way here. They're going to take care of you, but they're going to prioritize their emergencies that come in. She took herself out of the emergency category and put herself in more of an ambulant state. And because she did that, it took an extra 15 days. And although I have a lot of pull in certain places, when you do that, you just tie my hand.
Right. Yeah.
And then you may ask, why she had private? Because she just decided to go there. And my mom wanted to do that.
That's so gringo.
That is.
So we got a next one, right?
Okay, the next one is pets. I'm going to tell you why.
Wait a minute, pets. What?
Well, people bring their pets, and if they come in with their vaccinations and everything, and their health declines, pets are symbiotic beings with us. A lot of times when they get sick, we also get sick. So you have to have preventive care for your pets before coming, and then having a plan for where they're going, because not everywhere has a veterinarian, because people will get sick. And you got to have a plan where to put them, because if you go to the hospital, where are your pets going to go?
Man, I don't know. Where did you get that? That's a good correlation. I'm sure there's studies on that.
Well, there's a thing called One Health, and it's a worldwide understanding of how animals and us as humans are connected. And believe it or not, some of the animals are very well connected. And you think about the pig, he's actually almost 90% connected to us DNA-wise. So there's a lot to say about animals, how connected they are to us.
Yeah. No, I think most people that have pets would say yes. Yes to that.
Yeah, no.
So it's something to consider.
It's something to consider, something that you should think. And then medications, Mike. People come from the States, they bring their medications, come at least with a 3-month supply, minimum. And if you're not ahead of time, figure out what medications you are and to see what medications we can get at your local pharmacy. Obviously, if it's prescription-wise or if it's over-the-counter. Sometimes prescriptions in the States are over-the-counter here.
Yeah, but the other thing, like used to get this question a lot, like a lot of anxiety medicines or painkiller type medicines.
Yes.
What they're called. They don't, I mean, to get those, you have to go see a doctor again to get prescribed for those medications from a doctor in Costa Rica. You bringing your prescription from the States going, I need 2 bottles of oxycodone. You know what I mean?
Yeah. So
people do try that.
They try, but the prescription, just like a Costa Rican prescription, wouldn't be accepted in the U.S. The U.S. prescription is not accepted here, but at least it's a base point for a doctor to be able to prescribe you something. Is they have something to support your condition. So yes, you can get it. But you get a physician here in Costa Rica to do it. But making sure all the medications that you have. And then sometimes the medications here have different names. Same ingredients, same supplier, say Pfizer, whoever it is, but it's called something different, and it costs different. That's something that you always have to really, because you don't want to run out of, if your meds and certain things, you don't want to run out. So make sure you know what you're getting, and we can help you with that if that's the case.
I don't know if you know this answer, but what is it crossing the border with meds? You know, like if you're coming on and you're coming into Costa Rica and they're checking your stuff and you have 73 bottles of various stuff. What can happen, or what's the legal way that you should be doing this, or is that even a problem? Can I bring my 73 bottles of whatever?
You can bring your 73 bottles of medicine as long as it has your name on it. It's your bottles. The only time that it becomes a little bit of a different problem is when people bring supplements and bring, they're going to start a new store.
Supplements is a problem. I know, you're right.
It's more those cases, but medication, as long as your name is on it, they'll honor that to be able to be accepted. But it's just know that the proof is in what you have to show. This is my prescription. This is my name.
Supplements are an issue. I've gotten that email quite a few times about supplements. They took my supplements, or you can't get them, or
if you have if you're going to come in with supplements, have a physician write you, hey, you know what, this is dietary for this particular condition, and you're covered. But if you're just going to go to CVS or GNC and just pick up stuff because you want to, and then you're going to bring in a year's supply of
you're going to have a problem.
You're going to have a problem.
Right.
But if you come in prepared, you're not going to have a problem. Just, hey, you know what, this is my physician. This is what I use daily, and this is what I'm going to have. And you shouldn't have an issue. But if you're going to come here and become a GNC store, it ain't going to work.
All right.
All right, Mike, I think the last one is Facebook. Okay.
You're coming up with some different ones.
Yeah, well, Facebook is that everybody, how did you do this? And then everybody on Facebook becomes an expert on, you know what, I did this, and this is how it worked out for me. Or I did this portion, and it worked out. And some people have really good ideas, but you know what? Try to have sources that are in the field of what they're doing, suggest what you're going to do. And then even like, people don't know this very much, but pharmacies here think of it as a first line that you can also use without paying a subscription. And you can go, I have a cold, and they'll suggest something to you.
Right.
Or I want to get a shot. I feel like I got the flu, and they'll give you a shot.
I don't know. I want to expand on that a little bit with the Facebook because it's one of the biggest. There's nothing black and white in Costa Rica except there's nothing black and white in Costa Rica. So, Mr. Expert on Facebook that says, "Okay, here's what I did. This is great, and this worked for me." It probably did work for them, but that doesn't mean anything because it's maybe he got lucky. Maybe the person whoever he's talking to, the pharmacy, the doctor, the hospital, maybe they let him go on that. But maybe then when you go do it, it's a whole different game. So you need to know the legal way, what you're supposed to be doing, because Facebook is full of a bunch of people. Oh no, I did it like this. I did it like this. No, you're both wrong. And they're all basically right and wrong in a way. Because you know what I mean?
It's perfect. Mike, the things that happen here in Fortuna are allowed here in Fortuna may or may not be allowed in San Jose.
Right. That's a true statement. I know what you guys are thinking. You go, Michael, you guys are being dramatic.
The same country. Why would it be a different thing? No, some things in certain counties, or however you want to call it, are accepted in one place, but you can go across the street because the dividing line says it's this and it's not accepted over here. Same country, same rules, but it only applies to this little piece of dirt. Right. It doesn't apply over here.
Right.
So just
what he's really trying to say, guys, is if you're gonna do something, talk to Johnny about it because he knows what he's talking about. And he's going to give you the right answer.
Well, kind of, yeah.
Well, no, that is true though. I mean, you gotta. That's why I promote you so much because I know that you're going to give them the answer that is right and not the one that, well, why don't you try this thing and maybe it'll work. You're going to say, okay, here's what you got to do, and here's where you got to go, and here's what you got to see. This is what you can expect.
Yeah.
So
there's a hospital here in Chiapas, called San Carlos over here. The way to get into that particular hospital, into the emergency room, is different than the way that I was able to get into the Pérez Celedón. A different method. Same type of system, different hospital. But you have to adapt to the area, knowing what to say.
But wait a minute, you can't just say that. You got to give me a little example. Just a quick, this is our last little story. We've gone 3 hours already. So
all right, well, okay. I'll give you this one here. So in the hospital here, there's 3 entrances into the hospital. There's the entrance to the ambulatory stuff that people come in regularly to the hospital. There's an entrance for minor admissions, and then there's the emergency entrance. Right. Well, this hospital here where the emergency is, you want to go see somebody there. There's 4 or 5 security guards. They're going to ask you up and down why you're here and why you should be here. And you're coming to visit. Oh, he's not here. They're very vague.
Right.
I've
seen that.
Okay. So I've had patients that go there, but I know the hospital layout. You go to certain parts of the hospital, ask certain guards certain things. Hey, you know what? Where do you do this? And I think the best thing to do is you play a little bit of dumb and say, you know what? I need to just find out this. And then you get to that other station. I need to find out this. Oh, good. And then you know that station is close in the same corridor where the emergency hospital is. And you just go through that corridor and you get to the front of the line and you skip the security guard.
Right. Yeah. I've seen that. Again, people, you have to experience some of these things before you realize what
But also, too, I've seen good things, too. The CAJA has had people that have been in beds, and they have a tablet that's specifically a WhatsApp tablet that you can call in from, and I did it for a patient before, is that all the people were in the States, and I called between 11 and 2 o'clock in the afternoon. They allowed patients to talk to their loved ones via WhatsApp, but you had to sign up during that time. But you can talk to them at 8 o'clock at night between 8 and 11. And I would connect to the WhatsApp, connect to that person, and I connect all the people in the States, and they talk to the person. This is on the public care side.
Right.
private obviously is different, but it's just things that you can do.
Little things, yeah. Just a little travel tip or whatever. Everybody, all Central America basically uses WhatsApp. So, I mean, tourist places, doctors, pizza places, friends, everybody uses WhatsApp. It's obviously you don't have to pay for it. So, if you're coming to Costa Rica, going to be here, got to get on WhatsApp.
Yep.
All right, Johnny, thank you, guys. I know this is going to be, again, more questions and answers probably. If you want to get a hold of Johnny, again, go to our site. It doesn't have to be about medical dental tourism. It doesn't have to be that. If you want to ask him questions about, maybe something about the CAJA specifically or something, I guess he'll try to help. I don't know.
We'll try to help.
All right, so just go there anyway, guys. I'm Michael Allen. That's Johnny, travelcostarica.now.com. Peace, guys. Hope it helps. Things are going to pop up. If you're thinking about living or traveling anywhere, you should always do your homework and research. And if it's Costa Rica, I want to say our videos. Laters.